As a future physician, humanistic care is extremely important to me to provide strong patient care. I believe that humanistic care relies on us to incorporate our patients' values, perspectives, and beliefs into the care plan, making sure that our patients' voice is heard from the point of admission through the entire care process, to the point of discharge and beyond. Humanistic care, in my opinion, can influence patient outcomes in a positive way, help with treatment and medication adherence, and ultimately foster a strong patient and physician bond.
Humanistic care is important to me and will be at the center of my practice because I think it's important to remember that the patient across from you, whether you're sitting in an office or on the hospital floors or anywhere in between, is a human being. They breathe the same air, care for their families, and have aspirations just as you and I do.
In many fields, you're going to be dealing with people when they're really vulnerable and sharing a lot with you, when they're really anxious, and it can be very easy to get cynical. But if you just try to look into how they're a valuable member of society, how they're valuable to their family, it kind of decreases that cynicism and makes you a more personable physician, especially if you're spending 8 to 9 hours a day talking to people.
Humanistic care is really important to me as a future provider because I think it really helps establish a strong and trusting relationship with your patients. Often when patients especially are admitted to the hospital, they're in completely unfamiliar settings. They don't know who's around them, they don't know what's going on, and that can be very, very scary for a lot of people. And so by taking those couple minutes to really get to know those patients and build a relationship with them and build rapport, I think it, one, lets them know that you're somebody that they can trust, and two, that you have their best interests in mind. And so for patients, that can even motivate them to make the decisions that they need to for better health outcomes.
I want to go into women's health, so humanistic care has always been very important to me as a future physician. A lot of times my patients are going to be a little uncomfortable or feel a little vulnerable during their encounters. And so I feel like it's my job as their provider to minimize that discomfort. The best way I've figured out how to do that is to utilize the humanistic care, to show them compassion, to be honest, and through that building that trusting relationship, which will put everyone more at ease.
A time when a patient responded to humanism that I can vividly remember was in the emergency department during my rotation, where I had a Spanish-speaking patient. She really seemed to be fearful of what was going on, and at that point no one actually got an interpreter over the phone for her, so she wasn't able to have a voice. So I advocated for her just to make sure that she was able to get a translator and really have her needs said so that she felt as comfortable as possible in that situation.
An example of a patient encounter that I had was probably when I was doing my peds rotation. I had an ER week, and one night this 6-year-old girl came in. She had a broken arm, she was terrified, she wouldn't talk to anybody, not even the other medical student with me. She just felt very scared. So what I did after the doctor and the med student walked out, I just kind of sat with her and talked to her about what was on TV, kind of talked to her about what she was doing, what she was playing at the time, just to kind of remind her that she's still a kid and everything's gonna be okay. And she was able to open up with me and felt very comfortable with me and kind of wanted me to stay with her throughout everything else. And I feel like that kind of showed how being a little extra nice or just taking that extra step with patient care can go a really long way.
So an example of humanistic care is actually on one of my most recent rotations. I am a hopeful future family medicine doctor, and because of that, I am able to have continuity of care. And so on this last rotation, I was able to see the patient inpatient and then outpatient. And while they were inpatient for diverticulitis, they developed a headache, and everyone thought that it was just because of dehydration. They gave her a bunch of different pain medication, but I came in and I listened to her and I asked her about her headache, and it turned out to be because she slept funny from the hospital bed. So I gave her some OMM, and her headache resolved. She didn't have to take any of the pain medications that she did before, and then when I saw her outpatient, she thanked me. She said she felt so much better, and I felt really good because I actually got to help her in a time of need.
A time when a patient responded favorably to my humanistic and compassionate care was when I had a young family come in. It was a mom, dad, and their baby boy, and they were really concerned about his health. Doctors could not figure out what was going on with him, and I decided to spend a little extra time with the family to get to know them a little bit better. I used compassion and humanistic care to get to the root of the issue, and it ended up improving the outcomes for that patient and helped us get to a diagnosis that eventually ended up saving this baby's life.
What I would urge all these bright-eyed and eager new medical students to remember is why you are knocking on these patients' doors, many times at very early hours of the morning. I'd urge you to keep in mind what humanistic care is and its core values. Remember that humanistic care is not defined by the job you do, but is how you do it. Are you able to answer these individual questions and come up with a solution to these patients' problems in a way that is culturally competent and addresses their unique biopsychosocial issues?
For any new medical student that's coming in, I would say the most important thing or the most important way to impart humanism in your practice and really just your daily lives is to just be a student. And I say that meaning you should always be looking for feedback, looking for criticism, and finding ways to improve upon that. And by doing that, you just become a better listener overall, and you allow yourself, when you're in patient rooms or patient encounters, you allow yourself to develop a strong sense of listening with your patients and being able to get to know them. And that shows them that you're not just a robot and that you are a human being and that there is more to life than just the medicine behind it. You want to make your patients feel comfortable as possible.
In the future, for all medical students, including myself, in order to continue to be humanistic in my approach to medicine, and some advice I could pass on as well to others, is remember that we are treating people and not diseases. The snapshot we get of a person when they come to us as a patient is just who they are in that moment. And we only see them for a small portion of their life, and we don't get the full picture of who they really are. So it's important to keep that in mind and view them as people rather than pathologies or conditions.
To keep humanistic principles at the forefront of their medical school experience, my advice to new medical students is to take care of themselves by regularly engaging in self-care activities, whatever that might mean for you. As much as our interactions with others are informed by understanding where someone else is coming from, it really starts with what we bring to the table and how we show up. So ensuring that we're in a great mindset, open, ready to assist, starts with how we enter a study room, a lecture hall, or a patient's hospital room.
Advice that I would give to medical students, it sounds really silly, but just remember that your patients are more than just patients. They're people. They're human beings with actual lives and actual issues outside of the hospital. When I was a kid, I always thought that my teachers just lived in school. They lived and breathed school. They just stayed there all the time, were there waiting for me when I came to school the next day. And the same thing kind of applies to patients. Don't treat them as cases. They're real people. Take the time, as the extra flexibility that you have as a medical student, to sit down, have a conversation with them, get to know them, and that'll help you keep empathy and compassion at the forefront of your medical principles and values.
The start of medical school is hard, and it involves lots of time in the classroom and learning with very little time working with patients. Always remember that the reason you went into medicine is to help patients, and you will be helping patients with these disease processes that you're learning about, but it may not seem like it at the time. So try to keep focusing on the information you're learning and studying for your future patients.
According to the Gold Foundation, humanism in healthcare is characterized by a respectful and compassionate relationship between physicians as well as all other members of the healthcare team and their patients. It reflects attitudes and behaviors that are sensitive to the values and the cultural and ethnic backgrounds of others. The humanistic healthcare professional demonstrates the following attributes: integrity, excellence, collaboration and compassion, altruism, respect and resilience, empathy and service. Some of this may sound familiar as it is highly aligned with the tenets of osteopathic medicine that are taught from the very first moment our students and trainees step foot on our campus. As an inductee of the Gold Humanism Honor Society, I would advise new medical students embarking on this new step on the very long journey to become a physician to keep these principles at the forefront of their learning. We are here to treat people, not bodies. Yet you need to learn all of the anatomy and the physiology of the body and how each organ system integrates with the others. But just as important, if not more so, we need to explore and be curious about how the body integrates with the person and what makes that person up. Tantamount to drug interactions and medication evaluations are the person's hopes, life goals, and motivations, because without recognition of these attributes, no amount of medicine will get the person fully well and on the road to self-actualization. Don't forget that the people before you sitting in your offices or in the hospital rooms, there with chest pain and with cough, are parents and children, employees and caretakers, artists and thinkers, coming from different backgrounds in different countries all over the world. And these aspects cannot be separated from the medicine you practice.